Good afternoon and welcome to our daily media briefing. For the last few weeks, we've asked the citizens of San Diego County to disrupt their daily routines and to stay at home as much as possible. And you know, for the most part, many of the residents of San Diego County have just done that, and for that, we sincerely thank you. But we know that this week it's going to be probably a little bit tougher. Passover begins tonight, ushering in Holy Week for some religions, and Easter is on Sunday. It's a time of contemplation and celebration of your faith. We understand you need to cling to your faith probably now more than ever as we struggle through this crisis. But I want to encourage everyone, no matter what your religion, to please continue to avoid public gatherings. Many churches and houses of worship are offering their services online. So please check your website for your house of worship and find the times and mediums for virtual services online. Whether it's Facebook, Twitter, Zoom, Instagram, or another platform, please go online and practice your faith. Keep the faith, but please keep it online. Today we have some important news about public health order, which will be given by Supervisor Fletcher along with other information. And then we'll have our medical update by our Public Health Officer, Wilma Wooten, and then we will go straight to the questions. Supervisor Fletcher.
Thank you, Chairman Cox, and good afternoon. Our message today is very clear. It is to stay the course. As we have stated multiple times, and we will continue to reiterate, the day-to-day numbers and the day-to-day statistics that we share and the charts we share do not tell us a lot of meaningful data. We need to see significant trends over extended periods of time. There are fluctuations in day-to-day totals that really are beyond our control, but in the effort to be transparent, we are continuing to share everything possible, not only testing, positives, ICUs, hospitalizations, the unfortunate loss of life. We're continuing to share this information by jurisdiction, by zip code, by race, when possible, gender, age, when possible, and in every way to ensure that we are providing you all of the information that we have. But I want to reiterate that the day-to-day totals are not particularly meaningful in predicting what the future may hold. It is going to take a sustained amount of time, and so what we are asking the public to do is continue to stay the course, continue to adhere to all of the advice and the guidance we've given, and continue to focus on the things that we know. Physical distancing, staying at home, covering your face, hygiene, along with the things that we know in terms of raising the bar in our health system capacity. Yesterday, we reported only 50 new positive cases, and today we are reporting an increase of 76 for a total of 1,530. And I know that in the need for instant analysis and instant information, it can be very difficult to accept some realities of the situation we face. But I want to reiterate a couple key points in response to a number of questions that have popped up. First, the geographical breakdown of positive cases do not tell you anything meaningful at all, other than the individuals who happen to have gotten tested listed an address that is their home. It does not mean that that is where they contracted coronavirus. It does not even mean that that is where they physically are now in a state of recovery. It simply means that an individual who had access to a test, that test reported positive, listed that as their home address. With the limitations on testing, it is fair and safe to assume that every single zip code in San Diego County has positive cases, and we continue to encourage the public to assume, one, that you are positive, and two, to assume that those around you are. Those are the safest way that you can approach this in terms of staying at home, covering your face, ensuring physical distancing. Number two, the day-to-day totals really don't tell us a lot. We would need to see at a minimum a week, but more likely considerably longer than that, to have it have any reliable predictability about the trends or the directions on where we're going. While there are some encouraging signs of how California is doing as a whole, and there are some encouraging signs of how San Diego is doing compared to other urban areas of the state of California, the reality is we have to stay the course. The progress that we are seeing in San Diego and the progress that we are seeing in California is a result of the early actions that we took, but more importantly, a result of the widespread adoption that we have seen from each and every one of you out there, and we need you to continue to do that. Because if we misinterpret any evidence or data to suggest that the progress we were seeing in any way can allow us to lessen the commitment that we have, then all of the meaningful progress that we've taken to date will be undone. So again, any progress that you see or stories you see out there is a cause to celebrate the early actions in San Diego County and the state of California, to celebrate the early actions we have taken, but in no way can those be used as an excuse or a rationale or a thought process to any way deviate from the current guidance, or else everything can be undone in an instance. We know for a fact that our current restrictions and guidance will remain in place for at least the entirety of April. We have stated time and again the vital importance that the month of April presents to us, and we need to continue our full-scale commitment to the month of April. We also know that our early actions help buy us time. It bought us time to increase our health system capacity, both increasing in structure, increasing in staffing, increasing in stuff. We also knew that it gave us time to acquire personal protective equipment. It gave us time to get an increase in testing, and those are all things that not only help us navigate through the current situation, but prepare us for a day in the future when we begin to ease out of the situation we're in. At some point, that we do not know when that will be at the present, we will start to come out of the current environment. But it is really important, vitally important for the public to understand that we do not yet have a clear sense of when that will be. But when it happens, we will be very gradually coming out of the current posture that we have. And we need to prepare ourselves for that as well. In order to arrive at that date, we will also need the readily accessible rapid testing, tracking, tracing, and the appropriate way to put individuals who are positive in isolation to make sure that we don't prevent additional outbreaks. As we have examined a wealth of data, we spent a lot of time looking at the 1918 flu. And what you see in response to that pandemic was a number of jurisdictions that did not move fast enough to put in place restrictions early, and they paid a tremendous upfront cost. But what you will also see in response to that was a number of jurisdictions that came out of their restrictions too soon. And they had a second wave that in some ways was much greater than the first wave. Here in San Diego County, we did not make the first mistake. We did not wait to move too soon. We moved early, we moved swiftly, and our region is benefiting from that. And here in San Diego County, we will not make the second mistake either of coming out of that posture and scenario before it is appropriate and before it is being done in a thoughtful way based on data. So we again encourage you to adhere to the guidance, to commit to the guidance. The reason that we are in a better position in our state and our region is because of those actions, but we have to continue with them with all of our force and all of our commitment, at least through the entirety of April. Two other quick points before we get to our charts. On Friday, we will start sharing a few metrics that measure our county-wise adherence to the measurements put in place. This is some mobility data, some traffic data, some other data. We think it'll be a good way for us weekly to check in on our regional progress and get a snapshot of information. Some of that we shared yesterday and at our board meeting, but we plan to share that this Friday and every Friday moving forward. I also want to share with you that we made a small amendment to our public health order to bring it consistent with all of the guidance we've given. The old order had a mass gathering limitation of 10, but as we all know, there are no mass gatherings at all because the order is to stay at home unless you have to leave for an essential job or an essential service, and so that public health modification will go into effect now. Before I get to our charts, I want to give a special shout out to all of the San Diegans who heeded our call. We put out a call for individuals to sign up for our Reserve Medical Corps, and that call has been answered. To date, more than 550 clinical persons, doctors, nurses, EMTs have signed up to be a part of our Reserve Medical Corps. 200 additional non-clinical individuals, these are folks with healthcare experience in logistics and administration, have signed up. We have 150 additional physicians that have been made available by the San Diego County Medical Society, and we have 574 persons who have signed up for the Reserve Medical Corps to join but have not yet been assessed. To these folks, we thank you. We appreciate you. We value you. We also ask you to hold fast where you are. You are in ready reserve. in the event that we encounter a situation where we need you. And so you may not be contacted immediately, but know that we are tracking you, and we do appreciate you, and we will continue to assess the need on a regular and daily basis. Let's jump into our charts real quick. I mentioned today we have 76 new positive cases for a total of 1,530. On testing, we have our testing chart back. You can see an increase, we are now well over 20,000. We are at 21,718 total tests. Again, the day-to-day numbers mean very less. It just is the continued trajectory and continued increase. Here you can see our total testing at over 21,000 relative to our positives at just over 1,500. Again, we continue to have about 93% of the tests come back negative. That number has held steady for a little bit. Our chart that compares our positives to our hospitalizations, the newly added estimated recovery period. Just to reinforce, we are following what is accepted to be best guidance on the estimation of recoveries, which is 14 days after a positive test, minus any loss of life. This is pretty standard, but this is an estimate that you see. Again, you can see our hospitalization number at 316, ICU at 122, and deaths at 36. Our rate of doubling for hospitals is 7 days. Our rate of doubling for ICUs is just a little bit over 7 days, which are numbers that we continue to track, but are important indicators of our progress as a region. Motel rooms, we saw a pretty significant jump, increase in our public health rooms and occupied, increase in guests, pretty significant jump in the Regional Task Force on Homeless, occupied, and guest totals as they continue to advance with their mission of tackling the regional issues surrounding homelessness. Outreach efforts, 211 calls up, nursing calls up, epi calls up, hygiene calls up, hand washing stations and toilet distributed or static pending any additional requests for those. On personal protective equipment, an increase in every category. More than 50,000 individual items of personal protective equipment have been distributed since we spoke to you yesterday, bringing us to almost 1.9 million individual items of personal protective equipment that have been distributed. Ventilators, all 23 of 23 hospitals are reporting 533 available. That is not the total number in San Diego County. That is the total number that are available, along with our almost 100 ready to deploy, our 53 being serviced, along with the requests we have from the state of California and those that we have ordered. The final thing is a quick update on the pledge that we put out. A number of jurisdictions have been doing these to great success as a way for us to continue to reinforce what we're doing. Over 11,000 San Diegans have pledged to stay home and save lives. These individuals are making a commitment not only to themselves, but to one another. Today, we are adding and encouraging folks to download. We have some wonderful signs that you can post in your window. There are a variety of options that you can print off from the website and either write in your own message of who you're staying home for or download an accessible one. If you do one of these, feel free to post it online and tag us with Stay Home SD on social media posts as folks post these in their windows, again, as an outward sign of community solidarity and community action to try and tackle the challenges we face. With that, I will turn it over to Dr. Wilma Wooten for our Public Health Officer's report. Thank you.
Good afternoon, everyone, and thank you, Supervisor Fletcher. April is still an important month to flatten the curve so that we can get back to having our summer. So thank you to San Diego residents for doing your part to stay at home, unless you are going out for essential activities or as an essential worker. In this case, when you leave your place, we want you to cover your face. And regarding the next segment of my report, I'd like to share with you our global, national, and statewide statistics. And these numbers are based on the Johns Hopkins dashboard at about midday today. Globally, there are 1,475,976 positive cases that have been reported, and this includes almost 87,000 deaths. Nationwide, there were 404,352 positive cases, including 452 deaths. Today, the County of San Diego is reporting 1,530 cases, which is 76 more cases than yesterday, and 36 deaths, which includes 5 more than reported yesterday. So of our total 1,530 cases, 813 or 53% are between the ages of 20 and 49 years of age. And this is yet another reminder that this disease does not respect ages. And in fact, the age range of all of our cases goes from 3 months of age to 100 years of age. 737 of the total number of cases, or 48%, are female. 785, or 51.3%, are male. And 8 individuals, or approximately 0.5%, have no gender identified. 316, or 20.7% of our total number of cases have been hospitalized, and this is maintained since yesterday. 122, or approximately 8% of the total number, have been admitted to the ICU. This number is a subset of those that are hospitalized, and actually is 39% of the total number of those hospitalized. Lastly, the 36 deaths represent 2.4% of the total number of cases, and most had underlying medical conditions. 61% were male, and 39% of those that died were female. Regarding race and ethnicity, for those that have died, of the 36 cases, we have data for 27, which is 75% of the total number of individuals who have died. 15, or 55.6%, are white, 10, or 37%, are Hispanic, 2, or 7.4%, are Asian. At this time, none of the deaths are represented by Blacks, Pacific Islanders, American Indians, or multiple race designations. As I stated or alluded to, 9 cases had unknown race and ethnicity identified. Once again, our sincerest sympathies and condolences go out to the family and friends of those individuals who have been lost due to this pandemic disease. As a reminder, all of our demographic information is on our website, and the website is cited here in front of me, and that's www.coronavirus-sd.com. The information is provided by race and ethnicity, specifically for deaths, and also we have the cases by city municipalities. Regarding the outbreaks in congregate and community settings, today we are not reporting any additional new outbreaks and remain at a cumulative total of 25 confirmed outbreaks as reported yesterday. This includes 17 outbreaks in congregate facilities representing 108 cases and 11 deaths, and 8 outbreaks in community setting locations representing 33 cases and 1 death. In follow-up to a question from yesterday, currently there are no drugs or therapy that are FDA approved for the treatment or prevention of COVID-19. However, there is an FDA and Emergency Use Authorization, or EUA, for hydroxychloroquine, which is used in certain hospitalized patients, only in specific situations. It is not blanketly approved, again, by the FDA for the treatment of COVID-19. So we, as was stated yesterday by Dr. McDonald, this is something that family members would discuss with the provider of a loved one who's hospitalized. So again, I'd just like to emphasize that this is different from FDA approval and is a mechanism for providers to consider use of this drug in specific circumstances while we await the results of clinical trials that are currently going on to test treatment for COVID-19. So lastly, this week is National Public Health Week, which is a nationwide event to acknowledge public health, and it is coordinated by the American Public Health Association. It is recognized this year from April 6th through the 12th. Typically, in recognition of this annual event, the Live Well San Diego Public Health Champion Awards would be held on this coming Friday. This year, the event has been modified and will be presented virtually. And while everyone's mind is on COVID-19, there is still a lot of ways that we can celebrate National Public Health Week while keeping our communities safe. And beginning this Friday, we will announce one recipient each day until they are all completed. Yesterday, we thanked all of the hospital workers for their steadfast work fighting COVID-19. Today, we would like to thank all of the public health professionals for protecting the community and sharing the facts about COVID-19. Once again, thank you to all the individuals, organizations, businesses, and governments out there for all that you are doing to adhere to the orders for various non-pharmaceutical interventions that we have recommended and ordered. And this only goes to help continue to flatten the curve, to slow the spread of COVID-19, and ultimately to save lives. Now I would like to welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Booten. We're going to go straight to the questions now. We'll take the call-ins first. And again, if you're not identified by your name and your outlet when you are introduced, please do so before you get to your question. First caller, go ahead.
KPBS, please state your name and question.
Hi, my name is Matt Hoffman calling from KPBS. The blood bank says that local hospitals are reaching out on a daily basis looking for plasma to get antibodies from recovered coronavirus patients to use as a potential treatment. Is this a treatment or preventative that you're recommending for hospitalized COVID-19 patients here? And can you give us an idea of how many people there are in our county that have recovered from the virus and therefore might actually qualify to donate this plasma?
Dr. Efantides is going to respond to that question.
Thank you very much. Perfect timing for the answer to this question. Just last night, I had a conference call with some national clinical leadership from the American Red Cross. Later today, we have a call scheduled with the leadership of our local blood bank. The decision of what is called convalescent plasma is something that is, again, typically done at the bedside. We are very enthusiastically and aggressively looking at having a regionalized, coordinated system in place for this. Currently, as was mentioned, with regard to special considerations for certain therapies, medication therapies, there are similar exemptions available for plasma transfusions. As was mentioned in the projections that Supervisor Fletcher went over already, you saw the number of projected folks that we have that are recovered. What we are going to consider is the possibility, knowing now that the things are in place at a national level, of us having a very coordinated regional way of maximizing plasma donations and then coordination with the different blood banks to make sure that the patients for whom their physicians have indicated would benefit from it will be able to have access to that. So it's an extremely timely question. More details to come on that very shortly. Thank you.
And just a quick follow-up on that, Dr. Nick. So have you guys seen any indication that these antibodies might actually help somebody who's infected now with the virus?
There is some evidence from around the world, and there are already with the FDA some structures in place. There are different ways of doing confirmations, whether it is waiting for 28 days after a positive test or doing a follow-up retesting at a 14-day interval. Certainly there is some preliminary evidence, which is exactly the reason we are going to pursue this regional possibility very enthusiastically. Thank you.
Thank you.
Okay, let's go to the next question.
10 News, will you please state your name and question?
Kimberly Hunt, thank you. Just following up on the recovered, and while I'm on the phone, I cannot see your charts. What is the criteria for you to qualify someone as recovered?
Okay, I think Supervisor Fletcher is going to respond to that.
It's just a 14-day period from when there was a positive test result. So this is right in line with what Johns Hopkins and others are doing. So you simply take the date that you had a positive, 14 days later, you assume them to be recovered. You adjust that by any loss of life. So that's why we say it is an estimated recovery. It is not an individual tracking of each individual person. It is a statistical estimation following best practices that are being followed across the country.
And Supervisor Fletcher, one other thing just to drill down more on what you were referring to. It goes without saying we are still following the stay-at-home orders, but you mentioned a gradual time will come eventually. How do you see the county opening back up in terms of would restaurants have fewer seats? Would people be wearing masks when possible? Could temperature be taken at the entry of high-rise businesses? Specifics?
Well, we're a ways away from that point, and that is what we really want to reiterate, is that for the foreseeable future, any progress we've seen in any positioning of San Diego or California as doing better than other jurisdictions is a result because of the actions that we are taking to this day. And so those actions have to continue at the same level of commitment or all of the progress that we've seen would be undone. At such a point, of course, at some point in the future, we will come out of this. And at that point, I think it will be a very gradual undoing. Again, referencing the lessons from 1918, the jurisdictions that came out too rapidly or too soon actually saw second waves that often were more severe than the first wave, and we don't want to make that mistake. And so we are beginning to discuss things for the future, but I think that it is going to be really important to note that it will be very gradual, it will be very incremental, and it will be something that is continually monitored. And so what we don't want to do is get in a situation where we take an action and then have to undo it. And so we're not going to, at this point, start speculating on what those steps would be, other than just to prepare everyone that when that point in the future arrives, it will be a gradual undoing. As we moved into this, dealing with this episode, we did kind of turn a dial. We just turned it very rapidly. We did a whole series of steps, sometimes many steps in a day, sometimes many steps over many consecutive days. And I think that everyone should be prepared that when that future point comes, it will be a much more gradual process out. And the other thing, and this is really important, is our ability to get out of the current posture is based on our ability to fully commit to that current posture right now. The more success we have right now in limiting the spread, the more success we have right now in increasing the capacity of our healthcare system, those are the things that will put us in a position to begin the process of a return to normalcy sooner. And so what we don't want is anyone in the public to read into any of the charts or any of the reports, hey, you know, things are going better than other places, so maybe it's okay for us to gather with a group of our friends or do things outside the guidance. We really need everyone to continue to adhere to the guidance.
Certainly. Thank you.
Okay, let's go to the next question.
NBC 7, please state your name and question.
Hello, everybody. This is Artie Ojeda from Channel 7. Regarding notification of the public on positive coronavirus cases, you all have consistently said it's up to the organizations or entities to inform the public. But what is the county's process and responsibility of informing those entities if the county becomes aware of a positive result first? And how long does that process take?
Okay, Dr. Wooten's going to respond to that.
Thank you, Artie, for that question. I think we've gone over this numerous times before, but I'm very happy to go over it again. And I'll start out with the first example of the very first case that we reported. We found out probably about 4 or 5 o'clock, about 4 o'clock in the afternoon, and 2 hours later, within 2 hours, after finding out about the case, our staff was investigating that case to gather information so that we could have at least information to share with the public where actionable actions could be taken to protect themselves. So in terms of when we find out about positive cases, we contact the individual that's positive after we have contacted their provider to let their provider know. And then once we can interview the individual, unless they are hospitalized or in the ICU, we ask them about specific or sensitive occupations, because that's very important. And then they, if there is a sensitive occupation or a business that they are associated with, we then will let the human resources department of that business know so that they can communicate to their employees. And we do that with every disease, not just COVID-19. So that is our process. And as soon as we find out about a positive, we begin the investigation. It doesn't wait until the next day. We contact or attempt to contact an individual. And sometimes we may not be able to reach the individuals for various and sundry of reasons, but that is our process with all of our communicable disease investigations. So the first is the case investigation, and then we will conduct contact. So we will contact the contacts of those cases, particularly if they are in sensitive occupations.
So, Dr. Wooten, while you may contact the positive person within a matter of hours, is it fair to say that it could be much longer, even up to days, before you actually contact their employer?
Well, it could be within 24 to 48 hours because, again, we have to get the appropriate information to contact their employer. And that is our standard process, Artie, here in San Diego and across the nation in terms of case and contact investigation.
Thank you, Dr. Wooten. As always, I appreciate your patience with me.
Oh, no, my pleasure. Thank you.
Okay, let's go to the next question.
KUSI, please state your name and question.
Hi, this is Hunter Sowards. I was just hoping if Supervisor Fletcher could reiterate the process of testing as it pertains to the convention center. Are tests being conducted there? Why or why not? And what happens when someone staying there is presumed to have the virus? And then I have another question for Dr. Wooten. Forgive me if this is already explained, but do we have a chart of the age ranges of fatalities?
Okay, Supervisor?
Thank you. Okay, so on the convention center, we have public health nurses who are on site. They are continually screening for temperatures and symptoms. That is the exact same process that we've had in a number of our homeless shelters throughout the county of San Diego, along with the same process we've had with our homeless outreach teams. And so we have the public health nurses there that are continually screening and assessing unsheltered individuals for any symptoms, which would also include a temperature check. If they show symptoms, they have a fever or they exhibit symptoms, then they are immediately put into isolation, and then they are immediately moved to a public health motel room. When they get to that room, they get a further evaluation by a nurse practitioner or a doctor to determine, do they need a test ordered. If they need a test ordered, then they stay in that room until we get a test. If they test positive, then they stay in that room until they've gone through the recovery phase. And so it is a very aggressive and very intentional effort to identify individuals early, particularly those in congregate care settings like homeless shelters, but also to identify individuals who are vulnerable, like those unsheltered, to try and identify anyone who has symptoms early, get them removed from that setting, get them into an environment where they can get additional screenings, where they can get a test, and where they can continue to get treatment. Does that make sense?
Thank you so much.
Thank you.
Yes, thank you.
believe the second part of this question is about the age range of those individuals that died, and the age range is 25 to 100 years of age for the 36 deaths. And we post this information on our website at the end of the day each day.
Is there a breakdown of each one?
Breakdown in terms of, well, it's 36 numbers. The information that we have is on a table that is showing right now, unless you cannot see that table.
Yes.
This is the
I
breakdown
pulled
of
that.
all of the cases, not the deaths. But we also have a table for a breakdown of deaths, and there it is, in terms of race and ethnicity. So these are the deaths, and the table beforehand were the overall cases. Again, all of this information is on our website. When you go to www.coronavirus-sd.com, click on the graphic that is the map of San Diego, and when you click on that, there are several hyperlinks at the bottom of that table that will provide you all of the breakdowns that we have shared with you today.
Wonderful. I see that now. Thank you so much, Dr. Wooten.
You're welcome.
Okay, we have 2 more call-in questions. Go ahead.
Voice of San Diego, please state your name and question.
Yes, hi there. This is Will Hensbury. And I don't know if Dr. McDonald is there today or not, but if he is, I'd love to get like an epidemiological perspective on this question. Looking at the increase in cases over the last week, not counting today's numbers, it looks like the doubling rate was about like every 9 days based on cases. And if you look at the 7 days prior to that, it looks like it was closer to 4 or 5 days doubling. So it seems like the nature of the curve has changed in the last week. I've talked to some other epidemiologists who have said that is encouraging. So do you agree with it's encouraging? And do you think that's a fair way to look at the numbers week over week and how the curve may be changing?
Dr. McDonald had to get on a conference call, but Dr. Ephantidis is here, and he'll answer that question.
Thank you. It is an excellent question, and by the end of this, you will all be epidemiologists. I think it's fair to say that we embrace this as an encouraging sign. This is the first week, the first 7-day period of time where that, if you would, doubling has slowed down. And we are looking for that to continue over a longer period of time. So yes, I would concur that it is some positive, early, encouraging evidence. The flip side of that, it is too early and certainly not meant in any way, as has already been stated today, to be taken as an interpretation to get ready to go out and do our thing. So in that context, is it an initial sign of encouragement? We believe it is. Does it, at this point, lead to anything actionable? Not at all. We have to maintain the posture that we have. This is a very, very critical and important period of time. Do you have a follow-up?
So, yeah, how much testing, like how much will testing play a role in trying to bring us out of social distancing measures? You guys were telling us early on, the most important things are what we can do for healthcare workers, social distancing measures. That's still true. But it seems like we would need a lot more tests than we have if we wanted to start easing restrictions, like in testing people with mild symptoms and no symptoms, so we can say, all right, this person's clear, this person's clear. Is that right?
Absolutely, and again, very impressive sort of sense and gestalt that you're getting. I will say that it is not just the availability of testing. The other thing that is on the precipice of occurring now is how quickly we get those test results back. The prospect that we will have, if you would, tests literally like are done for many things that we're all accustomed to, like sugar, blood sugar levels, and so forth, to have those tests done almost instantaneously is a tremendously positive future tool that absolutely will play a pivotal role in the customization. It's not the only, but it's a pivotal key consideration in the customization that Supervisor Fletcher referred to as the methodical, thoughtful, and incremental, if you would, turning down the dial, and perhaps even doing so, for example, for certain subpopulations based on test results and so forth. So the premise of your question is actually very thoughtful and very accurate. Thank you, Will.
Thank you.
This is Dr. Wooten again, and I just want to make a comment, not about that last question, but it does support what Dr. Ifantidis has already stated. All of the health officers' orders have been related to social distancing strategies that are evidence-based. And even as we last week recommended the facial coverings, there is evolving evidence to support why we are doing this. So all of our social distancing strategies are evidence-based, and we believe that because that we have flattened the curve because of those orders that have been issued where we have asked elderly individuals over 65 to stay at home, individuals with underlying medical conditions, as well as individuals with compromised immune systems to stay at home. We believe everything that we have done has had a direct effect on flattening that theoretical curve and having less number of cases, less number of hospitalizations, less ICU admissions, and obviously less deaths. So we believe what we've done here in San Diego at a very expeditious manner, quickly, has had an impact. But people should not think that, oh, you know, things are over or things are getting better and I can loosen up and not adhere to the orders that have already been issued. We still are in this for the long haul, and we're asking you to be patient and sacrifice. This is a small sacrifice to pay in the grand scheme of things. We want everyone to adhere to these orders through the month of April. We will adjust and see where we are. And again, we are doing the modeling and working with local researchers. And we want to make sure that we bring you the most efficient information, the accurate information in the next week or so. So I hope that clarifies things for everyone. Thank you.
Okay, we have one last call-in question, and then we'll go to the texted questions. Go ahead.
Caller, please state your name, outlet, and question.
Hi, this is Paul Sisson with the Union Tribune. I took a look at the today's Influenza Watch report that came out this morning, and once again, for the second week in a row, we see very low influenza case totals. For the previous week, there were 21. The same week last year, there were 331. The three-year average for that week is 222. Last week, we looked a little bit at how flu rates might be serving as a proxy for social distancing and the effect of social distancing. I think Dr. McDonald said last week that he wanted to see another week of results before he was willing to say that the flu rates are definitely showing that social distancing is working. I wonder what you guys can say about that now that we have 2 weeks on the books.
Well, Dr. McDonald is not here at this time, but we'll get Dr. Wooten to respond to that.
Paul, thank you for bringing that up. And Absolutely, we feel that our social distancing strategy, so everything that I just said in the prior comments still stand. And the flu watch, influenza watch, provides us additional evidence that our social distancing strategies are working, not only for COVID-19, but for influenza, and I would wager to say many of the other viral illnesses that occurred during this time of year. So we are very encouraged by that information on our influenza watch that our social distancing strategies are working. Thank you.
Thanks.
Dr. Wooten, we have a question regarding bending the curve. As we continue to see cities across the county bending the curve as a result of social distancing and staying in place, is there a reason for concern of a second wave of illness in San Diego and across the state from travelers or other states that have experienced more exposure to the virus?
So absolutely, we would anticipate that. Number one, currently there is no antiviral medication and there are no vaccines for COVID-19. So everything we are doing is really buying us time until those two factors can be implemented. We know it's going to be at least 12 to 18 months from the beginning of the year before we see a vaccine. We recognize that researchers are furiously working to develop antiviral medications. So having those on board will certainly be helpful. What we have talked about, flattening the curve, implementing the social distancing strategies, even if with us peaking, then coming down, we would have to, with no cases, have to have at least 28 days of no cases to say that the local situation is over. But it's not just local. COVID-19 is a pandemic all over the United States, across the world. So with individuals, if traveling occurs and that loosens up, certainly COVID-19 could be reintroduced into our community and other communities that have seen a decline in the number of cases over time as a result of the social distancing strategies.
And we have a question from Mario Escovedo from Channel 8. Our viewers are asking about grocery store bag policies. Some stores are not allowing outside bags in the store and are charging for store bags. Does the county recommend a policy? Are reusable bags not safe right now?
Well, grocery stores have always been charging for grocery store bags. What they are not now doing is allowing individuals to bring their own bags in, and that is certainly up to the store. The rationale is they do not want the introduction of possibly contaminated bags into their environment, and that is certainly within reason.
Thank you, Dr. Wooten.
This next question is about personal protective equipment, and Rob Sills will answer that question.
This question is from Alexander Wynn from KPBS. What PPE relief will San Diego County get under Newsom's newly announced plan to aid biggest counties? Oh, actually, that's from Mark Sawyer from KPBS.
Thank you. Yes, Mark, that was exciting news that we heard today that Governor Newsom is reaching out and purchasing a large quantity, millions of respirators and simple surgical masks, and not just one-time purchase. It's going to be a monthly purchase from what we understand. And just like in this past month, we will continue to submit resource requests to the state based on our need here in the county. And the state will continue to supply that to us. And with this additional very large amount, we should be able to see that if we request 100,000, that we're going to be getting closer to 100,000 instead of getting a percentage of that. So we're optimistic about it, but we will continue to go down every avenue that we have in order to secure the needed PPE for our healthcare providers and our EMS transporters and our long-term skilled nursing facilities. And that includes private avenues as well as through our state and federal resources. So thank you.
This next question deals with trial vaccines, and Dr. Efantides will respond to that question.
Yes, this question is from Taryn Mento from KBBS. A local lab, Inovio Pharmaceuticals, this week began testing its vaccine in its first human trial. An Inovio researcher says they hope in the second round of trials to use the vaccine in some healthcare workers, including here in San Diego. Have you had any discussions with local health systems and or Inovio about this possibility? And if you haven't discussed it, would you like to see some local medical workers participate in this kind of vaccine testing?
Thank you very much. A couple comments in response to that. First, I want to start off and make sure that our local fellow San Diegans understand that San Diego County is a little distinctive from other large urban counties in that we do not have our own county, quote unquote, tertiary traditional hospital or, full scope hospital system. As such, when it comes to this kind of coordination with regard to a new innovation, an opportunity like a vaccine, we are blessed to live in a part of a country where we are fortunate to have a lot of very cutting edge, progressive, tip of the spear biotech companies. There are opportunities for that collaboration and those clinical trials to happen between those entities and local healthcare systems is not something that we typically would have direct involvement with at the local level, but given these current circumstances and given the tables that we have talked about of constant collaboration, all-inclusive tables with executive, medical, nursing leadership, if somebody wants to send information, we will be more than happy to disseminate that accordingly. Participation, of course, in any clinical trial is something that is voluntary and would be up ultimately to the individual, but the institution making them aware of that opportunity is certainly something we can coordinate on a regional basis. Thank you.
This next question deals with testing for COVID-19, and Dr. Wilma Wooten will respond to that question.
Yes, this question, or this series of questions, is from Claudia from Univision. How are COVID-19 patients cleared from the virus? One patient told us the county had told him he was coronavirus-free 3 days after experiencing the last symptom. Is that the case, or do patients get tested again until the result is negative?
So, great question and an opportunity to, again, revisit how an individual is discharged from isolation, particularly if they're on home isolation. So there are two categories that CDC has devised. And actually, if you would care to, you can Google CDC discontinuation of isolation for persons with COVID-19, not in healthcare settings. So there are two tracks. One is if an individual has not had a test, and that would be the case for when we are telling individuals if you have mild to moderate symptoms, you can go home until your symptoms are resolved. So in that particular situation, there are three factors. The first is that you should have no temperature or fever for 3 days without the use of fever-reducing medication, as well as your symptoms being resolved, and 7 days have passed since the onset of your symptoms. So those are the three categories there. The second is if test-based, releasing someone from isolation based on whether or not they've had a test. And there are several categories there. You can either retest the individual twice within 24 hours until they are negative, or that depends upon the resources for testing in one's jurisdiction. Another is to also, if it has been 7 days since the test has been obtained that was positive, and the person has not, their symptoms have resolved, they too can also be released from isolation. So there are multiple two major categories, and it depends upon the testing availability. When it's a test-based solution or strategy that's being used, it depends upon the testing capacity in one's jurisdiction.
And so her follow-up was, when a patient is recuperated, when are they okay to move on to daily activities like grocery shopping without worrying about putting others at
into
risk?
So again, those same categories. You are released from isolation. Number one, you've had 3 days without a fever and your symptoms have resolved. And there's been, it's been at least 7 days since the onset of your symptoms. So,
And, I'm sorry to interrupt.
No, go
And
ahead.
she was asking also, is there an updated estimate of patients who have recuperated or have gotten past the COVID diagnosis?
so in the, if you can place it again in the graphic that Supervisor Fletcher discussed, it is an estimation using the 2-week period. And we're being more generous than what's the guidelines are. We're giving it at least 2 weeks or 14 days since an individual was diagnosed. So that is an estimate. All the other information on this slide are actual cumulative data. So if you'll see here, and actually if you can go back to that, that's not it. That's for testing. There you go. So the recovered number we have as of today is 247 of those individuals that have recovered out of the total number of over 1,500.
All right, thank you, Dr. Wooten.
This last question is going to be responded to by Supervisor Fletcher. It deals with the housing of COVID patients.
This question is from Bill Feather with NBC7. Regarding Crown Plaza Hotel in Mission Valley Hotel Circle area, can the county confirm this is one of the locations being utilized for COVID-19 patients? And the second part of the question is, can you confirm San Diego PD is providing security at this location?
Thank you, Bill. We do not disclose the home address nor the individual address for individuals who are positive who are seeking care. That would be a horrific violation of their privacy. We would ask you to not do that either. What I can confirm is that one of our public health motel rooms, a number of individuals who are seeking care and are in a very difficult state. They are suffering from this illness. They are dealing with the complications of that as they try to seek treatment and get better. At one of our locations, a number of them have had great concern and anxiety with the presence of news cameras and photographers on site. They feel it is a violation of their privacy, and it is interrupting their ability to focus on the desire to get well and complicating our ability to provide an environment where they're comfortable staying to prevent the spread of the virus. I can also confirm that law enforcement has had to respond to those concerns. Again, not what we want law enforcement to be having to be dealing with these days. And so we continue to provide updates on the availability of the rooms, the protocols, the processes, the contracts for each and every one of those, and we continue to respect the privacy of individuals who are dealing with difficult situations. And we would ask all San Diegans to please join us in this same effort. Thank you.
That completes our calls for today, but before we wrap up, I wanted to let you know that tomorrow afternoon we'll be having a special Board of Supervisors meeting at 4 p.m. As we have done lately, it'll be a telephonic meeting so that we can avoid any large gatherings. The purpose of the meeting is going to be to call upon our state leaders to build upon the leadership that they've already shown. And I have to tell you, I think the governor and the members of the legislature have been very, very positive and upfront in what they've been attempting to do over the last few weeks. But what we're going to be trying to do is to see if we can't get some additional help, basically a statewide strategy with adequate funding to address the issue of homelessness in our state. Certainly it's needed now more than ever. Our county has taken a number of steps already during the COVID-19 outbreak to address those who are homeless or at risk of becoming homeless or those that are ill. In partnership with the Regional Task Force on the Homeless, we have procured a number of hotel rooms for those who have no shelter to safely isolate if they are vulnerable or if they have symptoms or if they've tested positive for COVID-19. In addition, we have created safe distance shelter beds for those who have been in bridge shelters at the convention center. Tomorrow's action would keep the momentum going as we work to address homelessness statewide issues beyond COVID-19. Lastly, as is our custom, we're going to end on a positive note. As you heard from Dr. Wooten yesterday and again today, this is Public Health Week, and Americans throughout our country are thanking public health workers on the front lines of this pandemic fight. In San Diego and neighborhoods throughout America, residents have been going out on their balconies every night at 8 p.m. to cheer, to make noise, to flash lights on and off, to celebrate our amazing public health workers. Thank you, San Diegans, for everything that you're doing for this small but positive act of unity and resiliency. I want you to know that the County of San Diego is right there with you. Each night, our historic county administration building in downtown San Diego is lit up in red, white, and blue to honor our incredible public health professionals. Together, San Diego, we will light the light, and that leads us out of this crisis that we're dealing with, and we certainly thank everyone's help and cooperation in regards to that. We'll see you tomorrow at 2:30, same time, and remember, stay healthy, live well, and to stay well, stay home. Thank you.